One thing in healthcare, and maybe you can give some insight on this, is we've heard a lot of terms around kind of augmented intelligence instead of AI kind of replacing all of our systems and processes. It's kind of AI that supports the human and the human decision making rather than the AI doing it all. Where do you see the boundaries of that approach?
Yeah, I don't see in our industry that AI is going to ever replace the human part of it. I think what it's going to do is surface to them what they need to know as opposed to going and digging for it, right? That's how I see it. We're, to your point, we're augmenting it, right? We're not trying to replace the human element of it, but we're trying to save them time to be able to, we're in a clinical care environment. There's so many other value add tasks that we can do. So if you're I'll give an example. I mentioned there's the 70 million meals that are going through our software. Think about the data that we have on what people are ordering. But that's one data point, right? This is what people are ordering. With this software, one of the use cases that we have in progress is also the consumption part of it, right? So just because someone ordered the meatloaf, I don't know why meatloaf is always a great example. Just because they ordered it doesn't mean they consumed it, right? So this will help us see at the end of it when you take a picture, okay, they ordered it, but they didn't consume it. So the next day, or whenever they're looking at the chef is looking at from a meal plan standpoint, right? They're looking at what should we put on the menu. We're using the AI and the data to surface to them the recommendations on what should go on the patient meal based on not just what was ordered, but what was consumed. So it's all about, I think, using AI to surface smart recommendations back to them to be able to make quick decisions rather than kind of sifting through the data. That's how we're looking at it.
Now, we have a very broad audience. It obviously spans more than healthcare. You have this unique experience, though, of a massive AI implementation. So, if I'm somebody in logistics or manufacturing or even hospitality, kind of like you're doing, what's the one lesson from your pilot that applies kind of everywhere?
Yeah, I think that we definitely, when we wanted to do this, had some thoughts on what the impact here was going to be, what the workflow was going to look like, how we were going to go about planning it. I think you just need to know that you're going to have to make some shifts in what you thought, and it's little things about even the hardware, right? How we've applied it within the tray line. You might need to. We've had multiple iterations of even the hardware to be able to say, okay, well, this first beta version wasn't exactly the right model. So that you're going to go through multiple iterations, and then you're going to come up with use cases that you didn't even think about, right, as you're doing it. And some of that's going to come from the operators, the frontline workers that are using it. One thing we didn't even think about it, and we've rolled this out recently too. Why not, when you lift up you're going to lift up the tray cover anyway at that point to scan it? Why not check to see what the temperature is? So thermal imaging is something we've added as well in the past several months, and that came from, again, that collaboration with the folks that are using. Oh, okay, yeah, we should do that. So again, you're going to continue to iterate, and what you thought you were going to do, it's probably going to go well beyond that if you're open to it and you listen to the people using it.